We're at the Beebout Veterinary Medical Center, and I'm with Dr. Brandon Beebout, and we have a very, very, very special guest with us today. We have Thunder.
Yep, this is Thunder. He is 2 years old, and he came to our practice with just kind of a check lump right here on his left forearm, probably quarter size, but pretty raised and a little ugly looking. In dogs of this age, typically we're on cutaneous raised masses or tumors. We think of something with a big long word, Histiocytoma. Looks scary even under the microscope, looks scary on the outside, but very, very benign. And so that's initially what we had thought, but we do our due diligence. We do what's called an FNA, fine needle aspiration. So just take a couple of the cells there in that middle of that arm, looked at it under the scope, and immediately the hair stood up on the back of your neck. And I said, I don't think that's what this is. The Good Life Rescue that allowed us to take care of Thunder, who he's currently with, allowed us to send out something called digital cytology. We've talked about that. And so instead of getting it in the mail, sending it out 2 or 3 days later, get our answer, it scans the slide, sends it out to the pathologist. 2 hours, we have our answer. And so 2 hours later, mast cell tumor. My analogy to mast cell disease is melanoma. Typically doesn't bother you, but is obviously very deadly, and we know that about on our human counterparts. And so, so he was diagnosed with mast cell tumors. And it's in a bad spot because you have to get such good margins to get it all. And so we have previously done a pet doctor on that, Stelfonta. And so for those that didn't see that episode, it is an Australian rainforest orchid that has essentially mast cell tumor killing abilities. And so what it is, it's actually an intralesional injection. And so what we do is we measure it, we kind of base and kind of get our dose. We start them on antihistamines. Mast cell tumors have histamine granules, and so we know it's going to degranulate. And so get stung by a bee, your face puffs up, you get itchy, those type of things. You can even get into vomiting, diarrhea. And so he's on antihistamines and some steroids, anti-inflammatory, and then we do an intralesional injection. And then, as you'll see in some of the pictures today, it just eats away everything in sight. And so with that, tissue damage, pain, and so he's on fentanyl patch, he's on gabapentin, on some pain medications. You would never know it with this dog.
Yeah.
I don't know if he knows what pain is. I think he only knows happiness and peanut butter. And so he is about, we're thinking 5-6 weeks out. His lesion is almost completely healed, and really the main underlying sole goal is he's cancer-free.
So is this something that they'll need to look for later on? I mean, something to keep an eye on, I guess.
Absolutely. We're looking for reoccurrence in those spots. It is not impossible, but a lot of it is operator dependent on doing that intralesional injection. Even I remember, I mean, we do a lot of high-fiving when we feel really good about things, and obviously for you, to be cancer-free at 2 and not have to lose your arm, we felt really good about that injection, and we're talking hours. We did it at 11 a.m. By 5 p.m. This thing had turned purple and was already turning colors and wanting to slough. I mean, it's really, really rapid acting, and that's how you know we're going to get this thing.
Yeah. So if you see something like that, stop in and give a call and have your pet looked at.
Yep, and just like us, you see a freckle that's irregular, changing colors. Cutaneous masses that don't bother dogs can be a big deal, and we just want to do that fine needle aspiration, squirt it onto a slide. We can look at it. We can sometimes say, hey, peace of mind, or hey, we need to go do something about this.
This very special guest of ours is at the Good Life Rescue. So if you'd like to maybe adopt, we'll have all that information on our website. Thank you, Doc. Appreciate it. Of course. All right. Stay with us again next Monday for another edition of Pet Doc from the Beebout Veterinary Medical Center.